Hi, everyone. The objective of this video is to just offer some quick suggestions for how to learn the diagnostic criteria in the DSM for purposes of being prepared for the type of questions that might be seen on the National Clinical Mental Health Counseling exam or the NCMHCE. Step one, start with a tool that's designed to simplify the DSM-5. There are a number of resources out there that were specifically created to make learning the DSM-5 a little bit easier. You can use my online video series, The Defining Line. Many of my testers have benefited from DSM-5 Made Easy and others. So, starting here will give you an initial exposure to the material, and it'll make the following few steps I'm about to go over even easier to work through. For those of you who are already proficient with the DSM-5, do this first step anyway. It may just end up being a review for you, but chances are you'll learn something you didn't know before. Step two is reviewing the diagnostic criteria for the disorders in the DSM-5. There's diagnostic criteria for each disorder, and when you open up the DSM-5 to a specific disorder, you'll see that the diagnostic criteria is presented in a way that looks a little like a chart with the heading Diagnostic Criteria. So, to be clear, step two is not to review the entire section for each disorder, it's simply to review the diagnostic criteria alone. If you're pressed for time, you may want to prioritize those disorders that are most commonly diagnosed in the US. That does include Z codes. Also, during this step, some testers benefit from writing the diagnostic criteria out. It can help with retention. Step three, this is when everything really starts to come together. So each disorder also has a list of what are called differential diagnoses that can be found in the DSM. Just open up your DSM-5 to whichever disorder you're interested in reviewing the differentials for, and look for the heading called differential diagnosis. Differential diagnoses are disorders that have some shared criteria with the diagnosis they correspond to, but they also have criteria that differentiates them. For example, major depressive disorder is a differential diagnosis for anorexia nervosa. And one of the things that major depression and anorexia have in common can be severe weight loss. But what differentiates them is that most people with major depressive disorder don't have an intense fear of gaining weight or a desire for weight loss. So, step three is to review the differential diagnoses in the DSM-5. The objective of this step is not to prepare you for questions about differential diagnoses on the exam, although this will help with that too. But the true objective of step three is to take your overall diagnostic criteria knowledge to a much deeper level. The more diagnoses you're familiar with, the better. But again, if you're pressed for time, you might want to prioritize and focus your efforts on the most commonly diagnosed disorders when you're reviewing differentials. Step four is getting familiar with the specifiers. So at this point, the really hard work is done. And learning these should be pretty straightforward, but don't skip this step. On test day, you might be asked to diagnose a client, and you could see answers like bulimia nervosa mild, as well as bulimia nervosa extreme. And if you aren't familiar with the specifiers, it could cost you some major points on the exam. When you're thinking about where you want your threshold of knowledge to be in terms of diagnostic criteria, your goal is not to just be able to select the right diagnosis when you're presented with symptoms. Instead, your goal is to also be able to articulate symptoms when you're presented with a disorder. So the last step is to quiz yourself. You can do this the old-fashioned way, take an index card and cover up all the diagnostic criteria in the DSM and see what you can recall. You can recruit a friend or a loved one to quiz you. If you have kids, of course, let them get involved too. If you're a parent that's preparing for this test, you're setting an example. You can show your kids what it looks like to approach this sort of challenge with enthusiasm. You might be thinking, this would take me forever to do, to complete these 5 steps. But the truth is, once you get into it, it won't. If you manage your time well, and if you spend a little time on this each day, you'll be surprised at just how quickly you can move through this process. Most importantly, once you've mastered this stuff, you'll probably feel much more confident when you're working through practice cases, and you'll see the benefit of all your hard work in your scores. Of course, these are just a few suggestions, and everyone learns differently. So please comment below, share what's worked for you, and also what hasn't. Good luck on your exam. Bye.